Hello, and thank you for listening to this talk on balloon therapy in 2020. I'm Aurora Pryor, and I work at Stony Brook University Medical Center in Long Island, New York. My disclosures are here. Most relevant for this talk is that I am an investigator for Obalon, and I'm currently on a scientific advisory panel for them. I'm also a speaker for Ethicon. These are the three balloons that have been approved in recent years in the US. Reshape, which was a double balloon system, Obalon, which is a single air-filled balloon system, and Aurora, which is a fluid-filled single balloon system. Reshape has recently been taken off of the market, so we are now left in the US with both Obalon and Aurora as our choices for balloons. Inclusion criteria for the studies that define these balloons essentially were the lower BMI patients between 30 and 40. These were all tested on adult patients that had some history of obesity and had tried some more conservative weight reduction alternatives. People who have had previous gastric surgery and particularly were contraindications to balloons. And there wasn't as much study on some of the higher risk patients. Also of note, hiatal hernia greater than 2 centimeters is considered a contraindication, and H. pylori should be treated prior to balloon therapy if possible. How balloons are placed depends on the type of balloon. This is for the Aurora system. So after an initial screening endoscopy, the balloon is placed, followed by the scope, and then inflated under endoscopic visualization. The FDA approval for this is to fill the balloon with saline, although some endoscopists do prefer to add some methylene blue to the balloon, which is feasible, just so if the balloon has a rupture, that can be identified by the patient. But again, that's an off-label use of methylene blue. And there's the balloon just detached from the catheter and left in place in the stomach. The Obalon system is the gas-filled system, and this is a swallowable capsule that's attached to a tether. And it's then attached to an inflation system, which then has a pre-measured gas in it that inflates the balloon. This now has a new way of being placed that doesn't require fluoroscopy. It's using a digital navigation system, and that is attached to that catheter so it can be watched on a screen. It makes it more straightforward as an office-based procedure, still using the standard gas dispenser, and over time you place 3 balloons. This is a video that shows how the placement works. And so the screen is on, the patient now is swallowing the capsule, and you can see it bouncing there based on position in the patient. The capsule there is still vertical, so that's likely in the mid-esophagus. Here it's hanging up some, but still relatively vertical and still relatively midline. And now that it bounces and comes more flat and has a much bigger bounce, that's consistent with being in the stomach. So that's how you would actually identify it. And this is a very reliable way to place the balloon. After it's confirmed to be in the stomach that way and by a pre-pulse with pressure, the balloon is then inflated. How do you get your patient to swallow a balloon? Well, you do want to do a pre-test with a capsule, since you can see there it's pretty large size. And so we actually have them try a pill first in the clinic before you do the actual inflatable balloon. If they can get that down successfully on 2 different occasions, then it's worthwhile doing the procedure. Usually you drink some water quickly, sometimes some carbonated beverage. For people who have trouble, applesauce or something like that can be helpful. And for the most severe cases, sometimes a very ripe banana is helpful to give them a different consistency when they swallow it, so it's not as disruptive. The balloon procedure then with the Obalon is over a several week period. You place the balloons and you keep them for a total of 6 months from the first balloon placement, and then you proceed with the endoscopic removal. This is a picture of all 3 balloons in place on an x-ray, which you don't routinely get anymore, but you can see the 3 balloons both by the air-filled shapes as well as the valves, which have this kind of configuration that looks like a spool of thread, potentially. So how the balloons work is they really just occupy space in the stomach that can help patients decrease portion sizes, but it works also in conjunction with a behavioral modification program that lasts up to 12 months with diet and exercise. Here are the Obalon results. This is from the SMART trial, which was the FDA study looking at patients in a control group which still lost weight and the treatment group which lost more weight. There was a crossover point at 24 weeks where people in the control group actually got balloons. And you can see that the slope of their weight loss was similar to the patients in the first arm of the study. The arrows here indicate the time of the balloon placements, and they were weighed in for this study at a total of 48 weeks. Real-world evidence with the Obalon balloon actually looks better. Not surprising because these patients are actually paying out of pocket for the device and probably have more invested than the patients in the studies. But you can see here the first column is that SMART trial, second column is the commercial registry after the patients were paying on their own. And you can see the total body weight loss, excess weight loss, and BMI change in the two groups, which was higher in the patients that were actually in the commercial registry. Here's the Aurora results from their pivotal study, 38% excess weight loss at 6 months, clearly different than the control group as well. Removal of the balloons is done endoscopically, actually relatively similar for the two. There is a standard needle that's used with the Obalon balloons, and it's part of the Aurora kit in their system, but both of them get punctured and deflated and then grasped and removed. And this is usually a pretty straightforward, relatively quick procedure. Here are the patient tolerances of these procedures, Aurora and Obalon here in the two columns. Most common complaints are listed in the column on the left. Clearly, nausea and vomiting is particularly evident early on after administration of the balloons, but is reduced in the Obalon versus in the Aurora, and I think part of that's based on the slower administration. The other things that can happen are ulcers, 2% in Aurora and about 0.9% in the Obalon. But this is the most concerning potential complication. This is something that has been alerted after the balloons were on the market, and that's spontaneous overinflation or potentially acute pancreatitis, and mortality has been observed from balloons. So if patients present with new changes and you get an x-ray that shows an air fluid level for a fluid-filled balloon, that should be immediately removed. And if the patient is having complaints, it's definitely not something just to ignore and move along from. Here are some of the results here comparing Aurora and Obalon. The Obalon has the 2 percentage points. One is the FDA trial, one is the post-market study, but relatively equivalent results with the two different balloon systems, with total body weight loss about 10% at 6 months and goes down to 7% at 12 months. Placed again, either swallowed or endoscopic, and removal with both is endoscopic. So how I do this in my practice, if a patient comes in for a balloon consult, I'll talk to them about options. Balloon placement is actually not what most people end up getting when they come in for a balloon. Medical management is now pretty good with some of our pharmacotherapy, and I've found that patients seem to like that. It's titratable, and it's not as much as a big outlay of money at the beginning. And then some patients, once they talk to the surgeon, actually are very interested in pursuing surgery. So I think that's a reasonable option. And we do convert a lot of patients who really come in initially just wanting balloon. Patients who start in the medical management arm then may try something additional, either balloon or surgery. And even balloon patients may decide that they want surgery. And we're definitely seeing people a year or two out from balloons coming back and saying that they want something more permanent with a surgical solution. Some of the other balloons that we may see soon, SPATS-3 is one that's in trial now in the US. This has something different by being able to be adjusted in the patient based on their symptoms and results. So there's been one study published with 20 patients with the device, BMI similar range to the other balloons that we've seen, and they showed excess weight loss of 25% at 3 months and 41% at 6 months, with a total body loss of 15% at 6 months. So more than we've seen with some of the other balloons, but they did have a higher incidence of ulcer with 2 early removals for that. And there are trials underway right now with this device in the US. Here are some of those clinical results on the responders versus the non-responders. looking at their percent excess weight loss, and really significant number of patients do have pretty good results with this, with half having more than 50% excess weight loss. And then their non-responder percentages were less than seen with the Reshaped Duo or the Orbera devices. The other one that I think is pretty intriguing is the Ellipse. And this is swallowable, similar to how the Obalon device works, but this balloon actually degrades on its own, so it doesn't need an endoscopic removal. Currently in studies, and we'll see what happens, there are some symptoms when it degrades, and people have vomited these or had some transient bowel obstructions, but that'll be really the success or failure of this device, I think, is how that works in the patients that are undergoing study. So a lot of options for balloon therapy today. I think it's still something that's really nice to have in the armamentarium of a bariatric surgeon. And I do think having it even brings in patients who don't pursue balloons, so it's good to offer in your practice for a variety of reasons. Thanks for taking the time to listen to this talk today, and look forward to answering some online questions. Thank you.